Hi, it's Benny. This is topic 3. Recovery is more than symptom reduction. So I chose this topic because my mental health placement completely changed how I view recovery. Before placement, I thought recovery sort of meant a person's symptoms had to be resolved and that they were no longer requiring treatment at all. But sort of after working with patients in D1, I realized that recovery is much more personal than that. I met people who were still managing mental illness while they were trying to rebuild their relationships, and they were working toward their personal goals and finding meaning in their everyday lives despite the illness. This experience just helped me understand that recovery definitely looks different for every person. And then Article 1 by Valencia, Gonzalez, and De Rios deepened my understanding by exploring how mental health professionals define recovery and relapse. One of their findings that stood out to me was that while many professionals maybe view recovery as an ongoing process, some still focus primarily just on symptom reduction. And it reminds me that as nurses, our own understanding of recovery influences the care we provide. Recovery should not just be measured only by symptoms, but also sort of the patient's individual goals and then just basically quality of life. And then Article 2 by Mirko, Cutler, and River focused on sort of the person's caregivers like in their lives, and then just understanding that recovery-oriented practices with those caregivers. So they found that the carers or the caregivers wanted to support recovery for their loved one, but they often just felt excluded from communication and decision-making in the healthcare system. And then this article sort of reinforced that recovery is strengthened when the healthcare providers, like the nurses, work collaboratively with the patients and their loved ones, like who have consent to be involved. And then just that sort of reading this article reminded me that recovery is not just something people experience alone, I guess. It's often like influenced by the people around them as well. And then looking at this topic through a relational inquiry lens, I learned that recovery cannot be understood by focusing only on a diagnosis or symptom. Rather, relational inquiry encouraged me to consider each person's relationships and experiences and strengths and social circumstances, and really reminded me that meaningful nursing care begins by understanding what recovery means to the individual patient rather than just assuming what success should look like from a clinical perspective. And then one lingering question I continue to think about is how nurses can meaningfully involve families in carers in the recovery of the patient. I know like there isn't always like a simple answer to this, and it's like an area that I just hope to continue to like think about more. And then overall, this topic sort of changed the way I think about recovery, and just basically understanding that recovery isn't simply the absence of symptoms, but an ongoing individualized journey shaped by hope and relationship and personal goals. And just as I continue to become a nurse, I just hope to provide care just that's unique to the person and not sort of going on a script.